Like much of the country, EMT and paramedic agencies in North Alabama continue to see a shortage in staff, but an increase in call volume. Our Kenesha Dees has more on how our frontline workers are handling the pandemic close to a year later.
Unfortunately, a lot of it is probably significant to the COVID of these calls and stuff like that. But we have seen just this year in 2021, we have seen about a 10% increase in our call volume.
HEMSI Community Relations Officer Don Webster says there's been an increase in emergency and non-emergency call volume since last fall. It's a big difference compared to the beginning of the pandemic when HEMSI received fewer calls.
We've added additional units to help take care of this 10% call increase. So, we would like to increase our staffing and more people.
Webster says HEMSI is also experiencing a shortage of EMT and paramedics. Cullman Regional feeling the impact as well after losing a non-emergent transfer provider.
The other ambulance provider in our community decided to leave the market in December. And so now our ambulance service doesn't have any backup.
Cullman Regional purchased another ambulance and is now offering a $2,000 bonus for new paramedics who become employed.
We just want to be able to provide excellent paramedic service to our community, and we're hoping that that is enough incentive to get people to come and join our team.
And HEMSI is also looking to hire EMT and paramedics. For more information, visit rocketcitynow.com. Putting the Valley first, Kenesha Dees, WZDX News.